Hello, OCO Tahija. My name is J-Lo, the original indigenous male version. If you haven't heard that, yes, I'm here. So I'm from Florida State University, and I'm the founding director of the Center for Indigenous Nursing Research for Health Equity, which is the first of its kind worldwide. In the U.S., there are only 23 Native nurses with advanced education, that would be a doctoral degree, and just a few of us are involved in research. So I think there are 2 of us that are funded by NIH to conduct research. So we are unique. Yes. So first I'd like to again acknowledge the original people of this land, of where we are today. And again, as I've presented previously, if it weren't for the sacrifice of land, lives, and culture, that sacrifice, we would not be able to be here today. And one of the reasons I like to do this is I do a lot of work in Australia with our Aboriginal brothers and sisters, and this is mandated in policy. And so maybe we should, try to advocate for that mandate here, that anytime there's a public forum that we do acknowledge the indigenous and original people of that area. So I pay my respects. So our people, and I am guided by lots of folks in our communities, and one of the emphasis that they say, the youth must be our focus. We have to, if we don't save our youth and address and work with our youth, they are our future. And so what we're guided to really approach is to ask the youth, who are you, where are you, and where are you going? If you don't know who you are, you don't know where you are, you certainly don't know where you're going. So that has become the driving questions and the driving guiding force behind of what we do in addressing adolescent and youth substance use among our group. As you probably have heard today, here's some data about what our use is, what is known. There's not a lot known, but most of it does come from the National Survey on Drug Use and Health. And so, of course, you can see the rates there for our substance use rate, especially among 12 to 17-year-olds. But for us, what about youth 10 to 12-year-olds? And so that's not really known quite. There's not a lot there, but about it. And so our communities and the work that we've done, most of the communities, leaders, etc., and even the high school adolescent group said, go younger. You've got to start younger with preventing and intervening. So this is a little bit what's known with 4th to 6th graders, and the blue line is American Indian or Native rates. And so you can see, without going into all of the ones, but especially the marijuana, which has been talked about, some of the others, you can see it's pretty high. So our youth usually starts initiating substance use around the age of 10 to 11. And then it's higher than most other groups. So why the reasons? Well, there's usually in our communities, youth younger, there's not necessarily a separation between younger and older groups. Many times we socialize in a different way, and so in a closer way. And so one of the things is that so we're influenced. Our younger are influenced by the older group, and sometimes even what's happening in families and communities. So there is always a reason, and our elders usually mention to us that we should really talk about, to understand who we are today. We should talk about and talk about what happened to us historically and who we were in the past. So of course, without going into too much details because of time restriction, historical trauma is something that we pass on intergenerationally. We had forced removals, we had boarding schools, and all of the other things that come along with it. I would like to share with you one little piece of information and talk a little bit about this. And probably across the world, in most indigenous countries and areas that were colonized, the boarding school or residential schools was one of the things that was implemented, and it just did so much destruction with our people and communities. And so this is a real famous picture. So when I was doing in the early 90s my doctoral work and developing what we do today, I went and I wanted to get the story and capture really what that was like. I did not have to go to a boarding school. Like I said, my father never went to school at all, so he escaped that. But his oldest sister, my eldest aunt, went to a boarding school, and I showed her this picture. She was 92 when I was doing my work, and I went and I showed her this picture, and I said, "Auntie, what does this speak to you? What does this mean to you and your experience?" And so she took a while, and it took several days for her to really share her story with me. And at 92, she still could not, it was still very painful for her. And many times we had to stop, she had to cry, and it took days. But that was a gift. If you ever have the honor and the privilege of being able to interview and to talk with folks and our elders in whatever community you're connected with, it's an honor to get that story and for them to share with you. And it really adds to that whole passion about doing what we do. But she pointed out this little girl here, this one. You see, she's like this. And my auntie said, "See, children supposed to be happy." And no one, she said, was happy when they were at the boarding school. You see how they're all uniformly dressed. They were stripped of their culture. And she also explained that they had to come out every morning and be counted. And the way they counted was 1 little, 2 little, 3 little Indians. They had to count off. And that's where that song came from. So, of course, many of us grow up and people sing that song and like it's just a real nice little song that children sing, but it has deep-rooted meanings. And so she talked about that because if there were supposed to be 100 kids and they got to 99, they knew one had run away and escaped. And she tried several times to run away. So it gives context for why we have some of the issues we do. And then a real popular and a scholar and a researcher that did a lot of work, Dr. Fred Buvet, did a lot of work on alcohol abuse among American Indian, Native American substance use, and especially in alcohol. And he came out with, after reviewing, that one of the things was the loss of culture and not a way to be able to measure cultural factors was an issue for our youth, and so something we need to move to. That really gave me an inspiration when I was doing my early work, in that we needed to have native-driven, from our culture perspective, somehow a model. There's a lot of models we're asked to do if you're a student. You've got the health promotion model, and you've got this model and that model, but it doesn't necessarily mean that it has relevance to our culture and our people. So I like to use the circle that, most of the models that we use are that outer circle, non-native, and then there's some real generalized ones, and then there's the cultural specific ones and tribal specific. So I started with our group, Cherokee, and we came out with a model from lots of different studies. It's called Cherokee SelfReliance model. Then it moved to Native SelfReliance. And now it has evolved to be just Native Reliance, because many people were getting the whole word self was kind of referring to individualism, and we're really a collective group. But self, the way we define self, is not just this, it's everything we're connected to. So that's our families, our communities, all of creation. So now it's evolved to be Native Reliance. And we have a tool that we measure for the concepts, and that has shown some great reliability. And so another model that we have developed is called the circular model for cultural tailoring. And so this is a way we can tailor different models, and especially like the Native Reliance, to be able to be used and adapted for different other tribal groups and indigenous groups. So we developed what's called the talking circle intervention, and this is an intervention that is a 10-week, it's manualized session for Native and Indigenous youth, and we are now in the U.S. We're in Australia working with Aboriginal youth. We're in Canada with First Nations youth, soon to be in Panama with some Indigenous groups. We've tested this in many, many ways, and one of the ways that we've tested it is using a randomized trial approach, and we've tested it against where some youth would go through what's called the DARE or the Be a Winner program, which we know doesn't work for our kids, and so the talking circle is very cultural based and the approach is very different, and it's done and delivered what we refer to as a talking circle. And we use different measures for substance use, for alcohol use. We just developed a new alcohol use for measure, and it's called the AMI, the American NAMI, Native American Alcohol Measure for Youth, NAMI. So because there's just not any really available. There's a few, but not many. So that's alcohol specific. Just to show you a little bit of the results, the Native Reliance, you see what happens. The blue line is the talking circle intervention, whereas the green line is the other, the standard, which is usually the DARE, Be a Winner. And you see what happens even at baseline. They kind of start the same level with cultural self-identity as a Native person, and then post, and then you see where it goes afterwards. And we've even done some a year later for just to get a little bit more longitudinal results, and it stays up even post. And if I had time, I would share with you why we think that is, and you can ask me later. And I've had that interpreted through our elders and other people from the different cultural groups. And you can see the substance use scores. Usually the blue again, the substance use and substance involvement goes down and stays down usually after going through the sessions. Stress, this is very interesting. This was an earlier study where stress, you see where it went down, immediate post at data point 2 here, but it then 3 months later went way back up. And so we paid attention to it. They weren't using, but the stress went back up. So we redid some of our intervention sessions to focus in on the stress. And so what happened was we, after paying attention to it, then it started going down and staying down. And we had to really pay particular attention to the stress, which makes sense because, you know, there's a lot of stress in our communities and so forth and so on. Our youth were experiencing it. So now we're in the middle of, we're actually in year 4. Dr. Baldwin is a co-PI with me on this study, and we're now using the talking circle intervention virtually. And we're testing it using a randomized approach. And it's real exciting because we have 3 different areas in the country with tribal youth, and they come on and they do the sessions together virtually. And so, you know, and our youth are connecting to this very easily, and they're very much more technologically, you know, inclined than what we thought. And so it's real interesting for them to share, you know, somebody in the southeast to somebody in the central northwest. So that's been really good. Wado, thank you.